Maybe it is time to improve your medical presentations, presenting data, design methods, differentiating with animations and colors, using various kinds of agendas to guide the audience, and keeping the overview with print overviews like this. Please note that this video is made under the same conditions as we normally have when we prepare medical presentations. I don't use a studio, I don't have studio facilities, and I don't use an art director, nor fancy templates. My focus in these videos is entirely content. Your presentation should be easy to understand and easy to present. Welcome to the modular training system. Module 1 consists of these topics. We will dig into a number of practicalities and how to make it easy for the audience to follow your story and to understand your messages. And not least, how to make it easy for you as a presenter to give your talk. Between each chapter, you will find these divider slides. And please note, you can use these techniques immediately. So let's get started. Let's start up with the roadmap. It covers most medical projects. It is the core medical story, you may say the backbone in your story. And we will discuss how to build your story. But let's start up with the model. Seen from society view, we have a problem. Patients are dying, or we may not identify patients. And long term, the perspectives could be, maybe we can reduce mortality. Maybe we can identify these patients at an earlier stage and they can have a better treatment. This is actually independent of your project. In your project, you have to start with the background, then tell about your hypothesis, your aim, objective, and ending up with the results, conclusion, and the perspectives. Let me just put a few extra words on top of this. We have a problem. We know something, we think, therefore we have a plan. We found and we conclude. And based on these facts, perhaps long term we can change something. So these patients at risk, maybe we can identify them with a biomarker and thereby giving them a better treatment at an earlier stage. Sometimes in my courses, students are mentioning the problem and jumping directly to the aim. So these patients are dying from this disease at an early stage, therefore we're making an RCT. Doesn't make sense. We have to know, why are you making this RCT? Well, we have a hypothesis that this kind of treatment may give a better outcome long term. Therefore, we made an RCT. And then finally, how do we finalize our story? I'll just give that a few words. It could be done like this, with a conclusion, perspective. But you could also open a discussion, or maybe talk about clinical implications. Context, next steps. Well, if you're dealing with basic science, it's important that we understand where in the entire development within this area is your contribution, and what is the next steps. And finally, I would like to mention you have to pass certain milestones. Sometimes we think we are losing precious time if we spend too much time on the background, but we have to know enough. You have to give us as the audience enough information so we understand your hypothesis. The same is the case. Hypo and aim, we should know what is your plan, what is your target, it should be operational, what is the objective. And finally, understand the results so we can also understand the conclusion. That's important. So I'm talking about the core story now. The benefit of the core story. The essential point, it's the backbone, key content, and ready to expand or to collapse, depending on time or what you want to tell us. By using it consistently, you will make it easy to give your presentation, and I'm quite sure you will save a lot of time because you have the backbone, you have the startup, you don't have to start from scratch every time. We're talking about the story, the storyline and the red line. But maybe we should mention the stories instead, because often your presentations contain a number of different stories, and we have to be sure that we tell how do they fit together. So let's take a look at what is influencing the story. First of all, the time slot is influencing the storyline. In these examples, you have 4, 10, 45 minutes, but it's also influenced by the audience. Who am I talking to? What do I find most important? What is my priority? So these parameters influences the storyline. Let's take a look at the low one, the 45 minutes. So taking the 45 minutes, it could contain of a number of chapters. For instance, topic 1, 3 sub-studies, another topic, and so on. It is important that you guide us, help us through your story. So from the core story, when you dive into a sub-story, it's important you tell us where are we in the entire story. Now we dive into this story back. Where are we in the entire story? Now it's time to dive into the 3 sub-studies. Tell us. That will help us. This guidance is valuable for us. It could also be illustrated in this schematic way. Project story itself, topic 1, sub-projects, and so on. We could actually add another story, because if we give a supportive story, that could be helpful for our entire project story. A supportive story could be a case story, for instance. I could start off with telling one of the patients in my study was a 60-year-old lady who was presenting these symptoms and so on. And in that way, the audience can relate to this patient, the person, the persona, or how you describe this case. It could also, for instance, be a combination between registry study and a clinical example. Often it is difficult for clinicians to understand the registry studies. So maybe a connection or a description of a clinical example during your presentation may be helpful. And there's a number of other ways we can actually use a supportive story. These are some of the examples. Let me show you a graph. The graph shows the scientific level. It could be high, it could be low, over time. And we have a mixed audience, specialists, various kind, colleagues, staff, and laymen. It could be a defense, for instance. If this group, this part of the audience, that is our primary target, I would definitely go for this scientific level. Shape curve, starting low and increasing. If I have an other audience, which is my key audience for this talk, I would go for this shape, and I'll give some additional information to some of the specialists. This is actually where a case story can also be helpful. If we still have these specialists, they are my key audience. But I also want to give information to these groups. Then I would start up with a case story, telling about this 60-year-old lady and so on, starting as a starting point, and then increase the level. But I'll come back to the story repeatedly during my talk. And in that way, I'm directing my talk to the specialists in the field. At the same time, I'm also giving a talk to the other groups within the audience. So, summing up how to combine the stories, important. The supportive story can be helpful for you. You have to differentiate between the stories so we don't get confused. Help us, guide us. It's important that you guide the audience and that you're able to handle mixed audience or subgroups in the audience. We'll come back to that later on too. And now actually to something totally different. Am I on the right track with my current presentation? Can it get even sharper? Well, let's dig into 7 different elements in your talk. These are the ones: objective, audience, content, and so on. First of all, define your objective. Well, is it scientific, educational, or is it funding, for instance? If it's funding, it's something totally different. It would be a different content, a different view, a different approach, because you want funding or you want involvement. You want colleagues to help you recruit patients, maybe new centers or something like that. Different approaches. You have to figure out, why am I giving this presentation today? Meeting the audience, also important, because we are different. Our characteristics, what are the characteristics? Their education, their language. Are there any decision makers in the audience? So who within the audience, if it's a mixed audience? So you have to consider, who are they? I want to give this talk and I have to tailor it according to the audience. When you prepare, you also select the content. So you have to figure out your key content, make this core scientific story, figure out, is there anything I'm missing? For instance, my hypothesis, or should I remove something which now is redundant, but 2 years ago it might have been very important and relevant to include. Is there something I should get rid of? And my key messages, come back to that in a few seconds, but prepare this simple storyline, build on key messages. When you develop the storyline, that's the next topic, you have to create one core storyline, including the essence, establish the red line, and check again if it's easy to understand and easy to tell. And by the way, is it interesting? Is it exciting to listen to? So use a core storyline to help you stick to your story. Use it consistently. It is the same story you give when you present an abstract, a poster, or maybe another presentation. It can be helpful for you to use this kind of storyline. You can expand it or collapse it depending on time, audience, and your priorities. Number 5, that's the key messages. It's the most important messages, and you can repeat them during your presentation and use them as some kind of anchor points. Sometimes it can be beneficial also to tailor a consolidated message, a take-home message. I'll just give you one example. It is from my courses at the University of Copenhagen. Prioritize and prepare. Make it easy for the audience to grab your messages and make it easy for yourself. And not least, in a form that fits you. That's also important. And now, the level of interest. We don't want people to fall asleep during our presentation. One student told me, it has to be boring. No way. I'm quite sure we can increase the level of interest for our audience. Let's look at the level of interest over time. It can be high, it can be low. Let's say you have 8 minutes in a parallel session at a congress. When you enter the room, of course, interesting. Hypothesis, conclusion, interesting stuff. In between, what I call the killer period. And this killer period, that's where people leave, maybe because they want to go to another parallel session afterwards, or maybe they need coffee. Can we do something to increase this level of interest? Yes, we can. We can definitely increase the level of interest. So what can we do? Well, we would choose from this quite short list. We could involve the audience even more. Maybe tell a story. It could be the supportive story, for instance, the case story. Or you could make us curious. Maybe use a teaser. Or turn off the projector. When you turn off the projector, you change focus entirely to yourself. That can also be a way of increasing the interest level, I would say. And in this way, I think the graph looks like this. Hypothesis, conclusion, perspective, of course. Maybe tell part of the conclusion up front. Results, of course. Also challenges. If the inclusion criteria for your RCT was too narrow, maybe tell a story about how it almost jeopardized recruitment of your patients in your study. That's interesting stuff to hear about. And of course, teasers. So I think overall, you can really increase the level of interest with using some of these levers. And now to the final elements, the slides. How about readability, font size, contrast, or maybe spelling errors? Take a look. If we go to the tools, maybe we could involve the audience even more or benefit from various animations. Overall, am I on the right track? Should I use this kind of checklist to get even sharper? And now it is time to prioritize. You may have precious minutes at a congress, maybe 6 minutes, 8 minutes, and it's an opportunity. And you have to select among your data and make some choices. Figure out, is it relevant, what I'm telling now? What should be the level of details? And how accurate can I make my presentation? It is all influenced by the audience, the importance and the way you are prioritizing your contents. I could prioritize between the different part of my story in a schematic approach with weight, low, medium, high. However, I would prefer to have a system or way which is more operational. Therefore I use time. It's the same approach. I just put in minutes and accumulate it. Also adding the supportive story and accumulate. In this way, I have an overview of how much time do I want to spend on the various sub-studies. For instance, 4 minutes, and 8 minutes on sub-study C. And accumulated, how long time does my talk take? So let me go back to the timeline. This one. I could also fill in the same amount of minutes here, 4, 4, 8, and accumulate like this. That can also give an overview of my time spent. A third option is this one. A visual overview like this one is giving the overview of the entire story, the chapters. And I could add timing. Timing will also help you on stage because it is operational. You can actively use these time slots and you can revise your plans. You can start to prioritize while you are on stage. It's easier done because you could have made preparation for how much time we have spent, where is the most important part, and so on. We'll come back to that much more. And when time is short, it's nice to know and have this overview so you can finalize in time. A print overview is a very effective working tool during preparations. You have an overview of your entire talk, the content of your talk. It can help you when you prioritize among topics and thereby facilitate it when you want to make changes in your talk. But even more, when you give the talk, it can help you keep the overview. We'll come back to that much more. I'll just start up by showing you how you prepare the print overview. Start up in the slide sorter. Take a print screen and insert an extra slide. And enter your print. Crop to adjust the print to an A4, for instance, like this. Adjust and make space for comments on top and below. Now it's ready to use. In this story, in this talk, I want to start up in slide number 3. And after slide 3, I would jump to slide 7 and tell the story in 7, 8, and 9. So I would start up pressing 3 enter on my keyboard. And the story will start here with this slide. After that, I press 7 enter. And I will start the next story about the elements, the sub-studies, and the main hypothesis, like this. Actually, now I would go back to my print overview, take a look, because from slide 9, I would jump to slide 13 and go on with my story from there, pressing 1, 3, enter, and this part of the story would be up running. And during this preparation, I would also put in timing. So overall, this print overview can give you this helicopter view of your entire talk, and it helps keeping overview, giving the overview, and keep time and help you prioritize during your presentation. And thereby you can overcome some of the obstacles or challenges if you're suddenly running out of time, for instance. Now let's take a look at how we are keeping the overview. I'll show you a 3-step preparation that makes it easier to focus. How to start up, how to get back on track, and how to adjust your talk, keep time, and thereby overcoming obstacles. So let's consider 3 different areas. First of all, the messages. Where are your most important messages in your entire talk? The most relevant sections. Let's take a look at an example. I have highlighted 2 examples here. Prepare, end of story, and release data step by step. The next step is the transition between slides or between stories. How do you start up your talk? And are there any full stop slides? This kind of slide could include a huge table, for instance, where you start to give an explanation, but you have to start again because it was quite difficult to give an explanation or give an overview. So, how do you restart if that's the case? This could be a way. Just write few words, only 2, 3, 4 words on the print overview. Let me give you an example about a roadmap. This is a model and so on. Then I'm up running. I don't need more than just 3, 4 words. Same goes. Let's say this one. That's a full stop slide. Then I have to figure out how do I get from there to there. And again, I add few words. It is tempting to spend less time on the background, and therefore then I start to talk about the first milestones. So the audience will see the following slide, this one. And on my monitor, I can see the same slide and the next slide with the difficult to start up slide or the stop slide, and the first words that I will use when I start up that part of my story. It is tempting to. And the story about passing milestones have started. And now it's time for a case from a hospital in Copenhagen. I was invited to a meeting just around lunchtime, 25 minutes. The first speaker was quite talkative, and my time slot was at risk. What could I do then? First, I clarified new options. Do we still finalize at 1 o'clock? We should finalize at 1 o'clock. So, I should consider, are there anything in my talk that I could leave out and still give the highest priority to the most important part in my talk? This is an overview with the slides from that day. I had 3 topics: easy to understand, culture, and RNA replication, which was a talk about illustrations and how we can change illustrations to support our story. I put in some words. Cultural influence could, and then I was up running on that topic. And I would start up the RNA replication with adjusting illustrations made, and I was up running. And from home, I had also considered timing. After 12 minutes, I would start up on this topic, and after 15 minutes on this topic. So I could save 3 minutes by jumping directly from this slide to slide number 45, pressing 4, 5, enter on my keyboard. And from home, I had considered that I would start the topic with these words. The next example shows that cultural influence could, and so on. I could also save 5 minutes by jumping directly to this part of the story, and it would start up with another example concerns gene coding, and so on. And I actually reduced my time spent from 25 to 12 minutes, and I used 3 shortcuts. And still, it was prioritized from home, and I included the most important part. I included the part I definitely had prioritized highest. That was important. So the third part, jumps. What could you skip, and how could you handle a jump? Let's go back to the example. Put in timing. You could save 5 minutes by jumping to slide 12, starting when you look at the details, and so on. Or jump from slide 16, you would save 2 minutes jumping directly to the case. So one of my patients was a 60-year-old lady who, and so on. So try out this 3-step approach. Make it fit you. Consider timing, focus areas, how to start up, and optional shortcuts and jumps. And of course, practice. And finally, a citation from one of my students. She gave a very important presentation and used the jumps. She told me afterwards, I never give a talk without my printed overview. So that finalizes the 6 topics in Module 1. Module 2 includes Slide Master, how to make and use animations, and how to differentiate between various topics. And Module 3 with focus and links, and also how to handle complexity. And finally, please contact me if you want additional sparring, one-to-one, and tailored according to your needs. So is this just PowerPoint? Yes, and it is on purpose, because it is reflecting your work situation. It's standard functionalities. There's no need to download additional programs. It's operational, and you can implement it immediately. So with this, thank you for using this training system.